And a new study is showing that physical exercise may help people fight addiction. Researchers looked at 43 existing studies involving 3,000 people and found that regular exercise associated with lower substance use in about 75% of the studies investigating that question. The studies were found to have a high risk of basis, but it's already known that exercise reduces anxiety and depression. Experts currently recommend most people get 2.5 hours of moderately intense physical activity each week and 2 days of muscle strengthening activity as well. And it's World Immunization Week, which aims to promote protection against disease through vaccines. And if you're not up to date with your routine shots, now's a good time as any to catch back up. Health experts say this season can serve as a reminder to protect yourself from potentially dangerous illnesses. Dr. Nia Vias of Cleveland Clinic says people over 50 should consider getting the shingles vaccine along with the tetanus booster, which should be given every 10 years. For those over 65 and others who have a medical condition that puts them at a higher risk, Dr. Nia says to consider getting a flu vaccine as well.
This is often the time we start scheduling our physical exams for the summer and for the fall. So it's a good time to remember that there may be some vaccines that you need just routinely. Not only does it prevent against tetanus, it also prevents against diphtheria and pertussis as well. And pertussis is on the rise. The protection is not lifelong, and that you may need a booster.
For preteens and teens who weren't already vaccinated as children, Via says this age group may need vaccines to help protect against hepatitis A and B. She also suggests protecting against meningococcia A and B and getting the vaccine that protects against the human papillomavirus, which guards against some types of future cancers. And the Food and Drug Administration has granted accelerated approval for Biogen's ALS drug tofersen. Tofersen is the first medication that targets a genetic cause of ALS, also known as Lou Gehrig's disease. It will be sold under the name Qalsody and is administered through a spinal injection. The FDA said a clinical study showed the drug is likely to offer some benefits to patients. However, the agency is requiring that Biogen continue to test the drug in people to make sure that it works. And a new study is finding that workplace discrimination could have a negative impact on your heart health. Researchers say chronic exposure to discrimination can lead to long-term stress reactions and a higher risk of developing high blood pressure. Researchers surveyed 1,200 people for 8 years and found those who experienced high levels of workplace discrimination were 54% more likely to report high blood pressure. And those who experienced intermediate levels of workplace discrimination were actually 22% more likely to experience high blood pressure.